It's safe technology for spine surgery, and it plays a huge role at the Arizona Brain and Spine Center. Here to tell us about the intraoperative image guidance and navigation is Dr. Mohammed Abdul Hamid. Good morning. Good to see you.
Good morning, Suzanne. Good to see you, too.
Let me first ask you, what is the intraoperative image guidance and navigation?
It is a state-of-the-art technology that allows us to acquire pictures during surgery of the patient when they're positioned on the table. And those pictures will be reconstructed into three-dimensional pictures so we can see the full anatomy of the spine that will allow us to increase the accuracy of performing the procedure. So it reduces the risk for complications for our patients.
And what's this picture of?
This is a picture showing the actual machine. This is what it looks like, and this is how we acquire those images before even doing anything to the patient. This is how the pictures are actually taken, and then the software will reconstruct those pictures into a three-dimensional anatomy model, and we can actually navigate through those anatomy pictures.
Now, besides this procedure, what is the most common way spine surgery is performed?
We've been using fluoroscopy, which is a strong, powerful X-ray machine. The only thing with that, it only allows us capturing two-dimensional views of the spine. And with the amount of radiation that the patient gets exposure to from the fluoroscopy, there is a slight increased risk just from being exposed to these extra radiation particles.
What are some of the roles that the intraoperative guidance and navigation, image guidance and navigation in surgery? I mean, how can it help? Like, what does it, what are you able to treat?
Since we can view the anatomy of any segments of the spine, we can use it for all different conditions of the spine, from trauma to tumor. And this is showing the screw, how they're actually being advanced inside the bone of one of the patients who had a fracture of their bone. And we can tell through that images that the screw is in the exact position where they want it to be to avoid all kind of injury to surrounding structures. So we'll use it for trauma, we'll use it for deformity, we'll use it for tumor cases. Really, anytime we need to get a good understanding of the anatomy of the patient to help us increase the safety of the procedure, we can use this technology.
So that's just one, it seems like, of many. What are the advantages of doing this procedure?
So the biggest advantages you saw in those pictures is that the screws, as we're putting them in, I can actually see the screw as it's going in second by second. And you'll see in these pictures, I can change the trajectory of the screw going from this picture to the next picture. The trajectory now and the angulation of that screw can be changed, and I can make adjustment as I'm proceeding with my surgery. So if the anatomy of the patient is changing, I can also adjust my approach. It's almost like think of it as like a live GPS machine inside the OR.
And, so this is a technology being utilized at the Arizona Brain and Spine Center?
Correct. I use this anytime I'm doing instrumentation for my patients where I need to increase the accuracy. It's a safer procedure. It reduces the risk for radiation exposure because we don't have to use as much radiation. Increases the accuracy of placing all the screws so we don't have to think about, do we need to take him back to reposition a screw that wasn't perfectly lined up. It also, and by doing so, it increases their safety, leaving the hospital and return to home.
Because I have to think, as a patient, anytime you say spine surgery, the more specific and exact technology you can use to do this procedure is.
Well, you have to increase the safety of what you do, and there is a lot of important structures around the bone, like the spinal cord, your nerves, your major vessels, and you want to make sure when you're putting instruments in a patient that you put it under the highest level of accuracy possible while minimizing the risk of other complications. And this is a beautiful technology that so far has been working too well for us.
All right, Doctor, thank you very much. A lot of important information out there. And if you want to find out more about the Arizona Brain and Spine Center, visit their website, azbsc.com, or call the number you see right there on your screen.